Hello again, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and this morning we're up early. This is not a normal time for us to get together to do these Doc Talks, but Diane Schabauer and Megan French, CNPs with Monument Health, you were told, as I was, you're getting up early and you're coming in to talk on a podcast.
Exactly.
So welcome.
Thank you.
Yes, glad to have you guys in here. First off, I just like, because you guys have never done this before, so I'd like to get a little background. Diane, let's start with you. You work with Monument, CNP. How long have you been with Monument Health?
I've been with Monument Health for a couple of decades now. Nurse practitioner, I've been with Heart and Vascular Institute the entire time.
Now, are you from here?
Nope.
More or less, or no?
Originally from Colorado, but moved here when I was in high school.
Oh, all right. So yeah, you're South Dakota.
I'm it. I'm a South Dakota. I'm it.
All right. And Megan, you're relatively new then to all of this.
Yes.
How long have you been here?
I've only been with Monument as a nurse practitioner for a year.
Okay.
I've been with Monument as a nurse for about 5 years.
Really? Mm-hmm. So why this profession? Why did you go into it?
I really liked the connections I had with patients as a nurse, but I felt I could serve them better as maybe a provider.
Okay. What is, really quick, I know we've talked about this before on different podcasts, but what is the difference between just a nurse and a nurse practitioner?
A lot.
Okay.
So from the standpoint of a nurse, you can have a bachelor's degree, and then when you're a nurse practitioner, you have to go back and get an advanced degree and then do a substantial number of hours. Most of the time you're doing a research project, and then you either have a master's degree or a doctorate when you get done. It allows you to practice independently. It allows you to see patients and do hospital work and clinics all at the same time.
Okay.
And then whatever else you think.
I would say it has to do with like the decision making.
Agreed.
As a nurse, you get to report your findings to someone. We are the someone that they report to.
That is a big transition, going from someone giving you the phone. It's true.
That has to be. No kidding.
It's a big change.
Mm-hmm.
But you have to like that responsibility, I'm assuming, as well. I mean, that and all that comes with it.
I like it because I think you get to be a patient advocate more.
Yeah.
You really get to work with those decisions and figure out a way to be there for them, and I really enjoy it.
Okay.
And
no, go ahead.
I feel like the learning and the information that I've gained from my advanced degree helps in patient relations and helping patients understand why I'm prescribing this. Not just because I told you so and I wanted you to have this. I get to do that background education.
I guess that never would have occurred to me. A lot of times, I suppose, as a nurse, you're just saying, I was told this is what you're going to have. You get to sit down with them and say, now here's why you're doing this.
I will give nurse practitioners and PAs a lot of credit. I think we do an amazing job of education in terms of educating the patient cardiovascular disease, because cardiovascular disease is scary to most people when you're talking about your heart and things like that. So I think we do a really amazing job of patient education.
Well, and that's why we have you guys in here today, because of the American Heart Association launching the Go Red for Women movement, which I believe happened back in 2004, I think.
Correct.
Is when this all began, correct? Why the need for this?
So from my perspective, when looking at this, because they just did their 20 years last year,
Right.
Cardiovascular disease is the number one killer for women. 1 in 3 women are going to die of some form of cardiovascular disease. Women account for most of the stroke deaths, hypertensive deaths, and we're significantly underrepresented in research. And we also have the other concepts that come with it from a reproductive standpoint, gestational diabetes, preeclampsia, estrogen, menopause, those types of things. And in general, we have smaller vessels. So we don't do as well. And I think when you add on top of that, we present abnormally, that what people would say. We have very vague symptoms from a cardiovascular standpoint. So American Heart Association was like, we have to somehow educate not only the public but women. Mm-hmm.
And I guess I'm so surprised by the fact that this is only a 20-year-old deal, that this hasn't been around much longer than that. Does that surprise you guys too?
Well, if you think back to like medical school, that was mainly men.
Right.
What did they study?
Sure.
Men.
Yep. I suppose that makes perfect sense. But it's in what is interesting and what I've learned from talking to a lot of doctors, especially at the Heart and Vascular here with Monument, is how different a lot of these symptoms with heart conditions for women can be from men. Almost silent in some instances, right? Can you give me some examples of what that is?
So women with cardiovascular disease, we've had those unique life situations where it's birth and everything like that. A lot of times don't have the crushing chest pain that you think of with men. They're like, oh, grab my chest and I'm having a heart attack. Women, it's more subtle, I guess I would say, more shortness of breath. They've maybe noticed it over 3 months or so. They can't climb the same flight of stairs that they used to. I don't want to say anxiety, but just kind of that sense of something going on.
And that's exactly right. And the other part of it, too, women are much more likely to just say, I kind of felt like I had the flu and I just never got over it. I'm just tired. But to her point, the anxiety is actually part of it because women go in just saying, I just really don't feel good. And it's hard for providers to direct, okay, is it because you're anxious or are you having a heart issue? So we're very vague in terms of how we present. And that is hard for providers to figure out the direction.
Why is it so vague? It doesn't seem like we're built that differently, when it comes to the system in our body and how it works. Why is it so much harder to detect for women than it is for men?
Is it just how women, not the psyche part of things, but maybe just how women interpret their signs and symptoms?
Oh,
more or
sure.
less.
Maybe that could be.
Whereas men take it kind of as it is.
We overreact.
So
Not exactly.
what I would say is it's the equivalent of what you would call a cold versus the man cold.
Oh, no, that makes perfect sense, right? Exactly, yes, because when we're sick, it's just the worst thing in the world. Why is it so crucial, though, to address the impact of heart disease on women?
I think because of we have a significantly higher risk of bad outcomes.
Really?
Because we wait longer to go in. Sometimes the diagnosis isn't made right away. And women, I think we have a tendency to discount things. So by the time we go in, we're in more trouble. And I think that's well, and the other part of it too is women, we like to nurture everybody else, whether it's our kids, everybody else, and we a lot of times don't take care of ourselves, which means we ignore those symptoms until we're in a lot of trouble.
So speaking of the symptoms, what are some, you kind of mentioned them a little, but what are like the key symptoms that women could look for? Because just in this little bit of conversation that we've had, it does seem really difficult for a woman to determine what that could be. And you don't want them overreacting. You don't want them like, oh, geez, I'm out of breath. I better run to the doctor because that could be a heart issue, right? So then what are really the key things they should be looking for?
I always like to say progressive decline, if you've noticed that. So if you are active and say you can walk a mile and now all of a sudden, or you've noticed like you've had to cut your mile short every once in a while or in the last 3 weeks, then I think probably we should get a stress test just to check things out. Short of breath, progressive. Don't discount the actual chest pain. I'm not saying women can't have chest pain, but don't discount that.
What is generally, that's another good question, because, as you get older, you do get chest pains that aren't necessarily have to do with your heart. You'll get pains, in the muscles around your rib cage and things like that. And people are like, oh God, there it is. There's a heart attack. That's a big one. I'm done. What kind of pain, can you guys describe what that kind of pain is like for a heart issue?
I will tell you.
Is it easy to?
Well, no.
Yeah.
Because if you ask people if they're having chest pain, about 100% of the time they'll say no. They're having aching. They're having burning. They have a little bit of pressure. I had one person tell me last week that they had a little cat sitting on their chest. They describe it very differently. Most people will not say it's pain. And that's the first thing, is to differentiate that and determine whether or not you think it's something. Most people will have a gestalt of this isn't quite right, but it is definitely different. Most of the time, if you're doing a heart issue, it's going to be, it can be in the center of the chest, but it can also be in your arms, it can be in your neck, it can be in your jaw. Those are very classic heart symptoms as well as into your back. So it's just anything in the chest area. And it doesn't feel right. For most people, they'll just know it didn't feel right.
Okay.
And kind of the fleeting one poke and then done isn't
cardiac.
Isn't always cardiac. So maybe just, and then exertional as well.
So that's like when you're working out and things like that, if you feel like you're saying, if you just can't go as far on your walk, or if you're out doing stuff with your pets or whatever, and you realize you're really short of breath all of a sudden where you never used to be, those are signs to absolutely get in and see somebody.
Right.
Okay. So obviously there must be lifestyle changes that people can make. There's always the big ones. There's the exercise, the eating right, and don't smoke. Right. I mean, those have got to be the big three still. Are there other ones that maybe are a little bit lesser known that you guys would recommend?
I would recommend a tight glycemic control, so getting diabetes under control.
Oh, sure.
As well as hyperlipidemia or your cholesterol.
Okay. So making sure all of those are checked when you go. And these are things you can generally ask your doctor or you guys as well. I mean, what do I need to do? What changes do I need to make?
Exactly.
Absolutely.
Exactly.
So there's got to be, you guys must work with women quite a bit that come in and have these pains and have these issues and have the worry. Do you guys get some pretty good stories that come out of these, though, from women that you've helped, from women that you're like, oh my God, I can't believe that's what it was, sort of a deal? Do you guys, is there anything inspirational to come out of this to get more women to pay attention to this, I guess is maybe what I'm looking for?
I think when I was just starting out, there was a gal. She came into the ER, had all of the risk factors, so hypertension, hyperlipidemia, family history, everything like that, but tropes just didn't add up. And finally, she's having these exact same anginal symptoms, exertion, and everything like that. And finally, the doc decided to cath. I think she got a stent.
Yep.
So just that's gotta feel good when you guys diagnose that stuff correctly too.
Well, we have to remember this is life-changing for that person now.
Right.
It's not just, it's everyday medicine for us, but for the patients, it's now you're on all of these medications, and we're trying to understand why you're on these medications and let you know kind of how you can play into your health care and everything like that.
Exactly.
Well, and the Go Red for Women, like you said, it's on its 21st year right now. I thought I saw a statistic about it that said that since this initiative has started, what was it? 90% of women who have participated have made at least one significant lifestyle change because of this. So
that's amazing.
Initiatives like this, because we see these all the time, right? There's always something. It's whatever month, right? For things that happen. Do you guys feel that these really make a big difference once the community is aware of it?
Oh, absolutely.
I would say even in the subconscious mind, you're like, oh, why are all these people wearing red?
Right.
I wonder what that's about. Then they go and Google it, and then maybe they forget about it for a month or two, but then oh, maybe I should make a diet change.
Exactly, 100%.
So it does matter. That's. I mean, it's great to hear. It's a little disheartening that it's only been 20 years we've been doing this, though, and finally, coming around to the fact that yes, it's dangerous for everybody. So what? I mean, community healthcare providers. It's everybody's kind of got to get behind this, right? And so, we encourage people to get out there, and we all decided this is the reddest thing I could find, and I feel like I'm not about to do some lumberjack work later, and I don't do any sort of physical labor at all. This is a great, and it's something I know I've heard about maybe for the last 10 years for sure. I don't know. I think it's getting better. I think the word is getting out there more. Is there anything else you really wish more people would understand about this, women specifically? I mean, you guys have kind of touched on a lot of the good points, but what else is needed from your guys' perspective?
I would say just acknowledging that we do have those unique life stages compared to men, like peripartum or everything, and then menopause as well, just acknowledge that we may have some differences.
Yeah. Well, you would think in today's day and age we would know the differences at this point, but this, like you said, it's a super helpful initiative that's out there. So, what do you guys think is the single most important action that people listening to this podcast can take to support heart health or get involved in the Go Red initiative itself?
I would say just that awareness. And when you're aware of it, they have a wonderful online site, the Go Red for Women. It's a wonderful site. It's very, very easy to work with. You can look at your lifestyle changes, what your risk factors are, and that's where it starts, is awareness. If we don't have women actually sitting down and going, okay, wait a minute. Yeah, I really do have all of these. Like she was talking about hypertension, diabetes, I have a family history. Then it's going to be much more difficult for people to move forward with it. So for me, it's awareness. And then once you have the awareness, moving on it.
Okay, and you should always be talking to your doctor about this.
100%.
You should once a year go in and have that appointment and have that checkup, and make sure. I'm such a huge advocate of that, of just getting in to get it checked, right?
Well, and the one other thing that I think was really important of the information I've read for women, and I always tell my patients, I'd rather have you come in 10 times and have them be something different than miss a heart attack. So if you come in and you're having symptoms and you really feel like you need to have something done, then you need to be your own patient advocate as well.
100%.
Yeah.
Don't sit on it, for sure. Get in. Monument has done some wonderful things. It continues to grow, which is great, especially the heart and vascular, which is, that's an award-winning division at Monument Health right now.
It is indeed.
So to be a part of that has to feel good too. And just to know that it's here. We don't have to go to Denver. We don't have to go to Minneapolis. You don't have to go to Rochester. You can go just right down there on 5th Street, and we're here, right? All right, so it is the Go Red for Women movement, which is, when is it underway here? Is it
The first
in
Friday
February? First
Friday
Friday in
in
February. Okay, that's when this will be airing then. I wanted to make sure I had that right in there so everybody knew for the entire month, throw on something red and at least start to raise the awareness. So Diane Schabauer and Megan French, thank you both for coming in and talking about this. See, it wasn't that bad. You guys did fantastic as well. And anything else you guys ever want to cover or talk about that's important to you, especially when it comes to nurse practitioners and the job that you guys do, I would love to have you back in and even get more specific on some things, to have that conversation as well, okay?
Okay, thank you, sir.
Thank you
Have a
guys
great
very
day.
much.